basically this is the way disease works. We have at one point, all things being equal, we have our health potential. We're in a state of wellness. This has nothing to do with how you feel. If we can measure every outcome on you and you're in this somewhere in your life, you're at a state of wellness, most of us. We can think of that time. Maybe we were 15, maybe we were 18, whatever it was, that we were at our peak. Then over the process of poor food choices, jobs where we sit all the time, things like that, we start getting silent inflammation. And it's called silent inflammation because there's no symptoms of it, but it's going on. And so we do certain blood tests for that, c-reactive protein, things like that. So we can see this silent inflammation in people. And then over time, that creeps up behind us and it creates chronic disease. So it's not that all of a sudden my shoulder went bad. I didn't do anything, doctor, but it just started hurting 2 weeks ago. No, it's been rotting for probably 10 years. That's how spontaneous things happen. They're not spontaneous. Just like nobody's ever had a spontaneous heart attack or a spontaneous stroke. You had a long-standing disease process building behind the scene, and it just spontaneously broke through the dam. But it was going to do that sooner or later. You see what I'm saying? Because the disease was building. Inflammation is the killer, and it's called the secret or silent killer. All medical experts agree this is 95% of what ails us in America is inflammation. So what is it? It's a complex orchestration of pro-inflammatory and anti-inflammatory events. You guys, we need inflammation. That's how you do wound healing. That's how you kill foreign invaders. That's how you fight infection. That's how you kill cancer. All these things. So we need inflammation. But what happens is kind of like where we might go out in the forest and do some controlled burns to keep it healthy and to keep it safe and to prevent future problems. In people in our country, when that control burn starts, it doesn't stop and it turns into a forest fire because we don't have the brakes. We have the accelerator, but we're missing the ingredients for the brakes. So what we tend to do is treat it medically with anti-inflammatory drugs. Whether those are prescription ones like corticosteroids, right? Prednisone, things like that, or we use the ones that are now available over the counter or by prescription. It's just doses, but same chemical like ibuprofen or naproxen or something like that. Does this make sense? This is how most of us do it. And I get people every day that come into my office, they go, I'm here because I don't like taking drugs. And I go, yeah, I can tell by the 13 drugs that you take on a regular basis you don't like taking drugs. It's absurd. Of course you like taking drugs or you would be living differently so that you don't have to. You evidently like to take drugs more than you're willing to change negative habits. That's okay, no judgment in it, but let's not lie. Let's just be up. Yeah, I'm not really going to change. I'm going to keep taking those drugs. Now, some of us have gotten so far past that point, you will have to take drugs the rest of your life. It is what it is. You let this train go too long. Some of it was ignorance. We were told, right? Don't eat butter, eat margarine, right? Eggs are bad for you. No, eggs are good, right? I mean, we were confused. But for those of us in that state, it should become your life mission to make sure none of your children or grandchildren follow your steps. Be considered a food Nazi. Go outside of the norm. Would you rather do that or not be able to tell them anything when you're at their funeral? So what's the goal? Heart disease, stroke, arthritis, all those, the goal is to decrease inflammation. Medically, we do, you don't need to write them down, just think any disease, name a disease. Parkinson's, there you go, decrease inflammation. Alzheimer's, decrease inflammation. Diabetes, just decrease inflammation. That's it. It's 95% of all disease. So what we use is corticosteroids, and what they do is they block one aspect of inflammation, but the problem is it stops all inflammation, and this is why steroids can be such a problem. Is that they actually prevent wound healing. You get steroid injections, the pain goes away, but it'll blow easier down the road. It'll break easier down the road. We made it weaker. Got rid of the pain, but we made it weaker in the process. It blocks, we need the eicosanoids to fight infections. So what happens when we take too many steroids? We become more prone to chronic disease, right? Non-steroidal anti-inflammatory drugs block a different part. It's called cyclo-oxgenase. It's COX-1 and COX-2 inhibitors. COX-1 are your Advils, COX-2 are your Aleve. Now COX-2 drugs came on the market because we knew something about COX-1 drugs. High numbers of people died of GI bleeding. from Advil, Motrin, Nuprin. So anywhere from 8,000 to 15,000 people every single year in this country die just from gastrointestinal bleeding from those drugs. So the manufacturers came up with COX-2 inhibitors. They got rushed through the FDA and approved for sale because it was allegedly safer on the GI tract than COX-1. Guess what all the studies have shown since it got released? No safer whatsoever. But actually increases the odds of having a heart attack. Right? So what do we see? Long-term use of these anti-inflammatory drugs suppresses immunity, causes osteoporosis, damages the liver, damages the kidney, causes more heart attacks, causes weakening of the heart, causes cancer, causes bleeding intestines, causes stroke, causes chronic pain and death. How ironic is that one? Now that's a pretty pesky side effect there, but this one's ironic. The more you take, the more you hurt. The more you hurt, the more you take. The more you take, the more you hurt. The more you hurt, the more you take. The more you take, the more you hurt. The more you hurt, the more you take. And patients come here and I say, get off those things. You don't understand. I hurt. I do understand, but you're never going to conquer this if you don't stop. I don't know the answer other than that. I'm not trying to be insensitive. But if your drug is causing your problem, you got to stop the drug. You got to stop the loop somewhere. So what's the better way? Control your inflammation with food. Number one, stop drilling holes in the boat. We've already talked about it. Number one goal, eliminate all sugar. Eliminate all sugar. Number one, eliminate all sugar. Number two, remember that grain is 80% sugar. C rule number one. Right? Fruit, yes, it does have vitamins and minerals in it, but it also has a lot of sugar. You get more nutrients from vegetables than you do fruit. So if your excuse is, I want the nutrients, stop eating fruit and eat more vegetables. See how this works? You guys do whatever you want, but you saw what the problem is if you try to do it medically.